Hello and welcome to Oasis Lactation Services on YouTube. Be sure to click subscribe so that you can see all of our wonderful content. And today we are going to talk about babies who are having latch-on trouble that may have a suspected tongue tie or other tethered oral tissue. And we're also going to talk about babies who may be having colic, gas, or reflux, and some exercises that you can start doing right now that are safe for all babies. So even if your baby doesn't have a tongue tie and you just suspect it and you haven't been seen by a provider yet, you can start doing these exercises because they're still beneficial and they're still fun for you to do with your baby. These are exercises that I recommend that all the families that I'm working with who are going to be seen by either an ENT or a dentist for a tongue tie evaluation. I recommend that they start doing these exercises beforehand, because usually they see me first and then they go and see the tongue tie provider. And that can take some time. You know, sometimes they see the provider the next day, sometimes it may be up to a week or 2 weeks. And so parents usually want to start right away improving latch, improving feeding, whether that's at the breast or with a bottle. So let's get right down to what some of these exercises do and why they're so helpful to use. So a lot of times when babies are having that latch-on trouble, they're not opening very wide. So we might see babies that only open this far instead of all the way. And those babies really need some help getting that jaw kind of stretched out. Because if we think about what happens in the womb, the baby's chin is up against the chest, the feet are in the face, and they're upside down in the womb. And this is the posture that the baby's in the majority of their existence until they come out here and join us in real life when they start moving in this direction. So all the exercises that we're going to talk about today are to help the baby develop muscles that move like this. Because when we have our chin on our chest, we can only open so far. But when we have our chin lifted, we can open a mouth much wider. So that's what we're really going to work on. If the baby has a tongue tie, that tie is going to keep that jaw kind of stable and stationary and not give a whole lot of range of motion, range of movement. So we want to kind of start stretching that tissue. Now these exercises and body work cannot replace releasing the tie properly by a skilled provider, but they can start helping the baby learn what that new range of motion might seem like and start feeding better right away. So the first one that we do is an exercise that I like to call a mountain climber. So we make a mountain with our lap for the baby. So I'm going to put my feet up. I have a chair here. And you probably already do this with your baby so that you can kind of check them out and spread them out and burp them and things, where the head is coming over the knees so that the neck flexes all the way back and all the way forward. The baby's nicely supported on your lap. The arms can either move forward or to the sides, or they can bend and tuck up under. But here, the baby, if the baby falls forward, it can't fall so far forward that they're startled because the legs are there to really be supportive. So this is really helpful for babies who maybe have had a cesarean birth, or babies with tethered oral tissue, or babies that really don't seem to have a lot of good head control, so that we're activating these muscles in the neck and the shoulders. We're giving that baby some gentle tummy time that's going to help with gas. We put a little compression on that stomach. It's going to help with gas and bloating and colic symptoms. And then the baby's kind of upright, but also at an incline like this. So if the baby is very refluxy, we get just a little bit of pressure that helps with gastric emptying, but it's also a really comfortable burp position so that the spine can be nice and long. Baby can feel very nicely stretched out, but they can also get a little pressure on the tummy to help with some of that gas. So when we do mountain climbers, I like to put the baby in the position. Baby does a little head lift, and then we can just kind of let the baby rest their face on mom or dad's lap, or grandma, or whoever's available to help. And then we just slide baby back up, And baby will do a little head lift and kind of engage those neck muscles. And what's happening is gravity is pulling on that low jaw and helping the baby to stretch without overworking these muscles in the neck and the shoulders. So that's really what the goal of the mountain climber position is. It's to stretch that jaw, stretch any of this tissue here that's been kind of clamped down by the fetal position, and help the baby really start to engage these muscles. We're moving, I like to tell people, we're moving from the cooked shrimp position to the baby feeding position. So they're born like a cooked shrimp, and we spend the rest of the time trying to get them into a feeding position. So this mountain climber position is a really good starter position for babies that are very new. Maybe they're a little bit early, they don't have really good head control yet, and they kind of need this as like a modified tummy time for pulling onto that jaw and helping to stretch. I like to do these mountain climbers maybe 8 to 15 seconds, and then immediately go to feed. Immediately put the baby to breast, or immediately feed with a bottle if you're bottle feeding. So that right after we get the good big stretch and all this great neck and shoulder activation, the baby can take that great movement and transfer it to the next feed. So let's say your baby is ready for some upper level head lift exercises. So here we're gonna put baby on the lap, and we're gonna slide the baby back. Babies tend to kick, so we're gonna hold on to that tush really well. And when you're ready, we just kind of slide baby just to the edge. Just to the edge, so the baby really has to engage for that head lift. Sometimes the baby will put the arms out to the side, sometimes the baby will put the arms out in front, and sometimes the baby will bend those elbows and try to scoop up. And any of those positions is fine. But we call this Superman head lifts because they're kind of flying. A lot of babies tend to put their arms out like they're flying, and they really have to work. This is a much steeper angle than in that mountain climber position, right? Here they're just doing about a 45-degree head lift. Here they are parallel to the floor, and this takes a lot of work for a very little baby. So we just let them do that head lift, and then we grab them by the tush and we slide them on back so they can rest their head, mom, dad, or grandparents' lap. And then do one more time, get that head lift, rest, and now baby's ready to go right back to the breast, right onto the bottle, and have a feed. So the mountain climber position, 8 to 15 seconds here. With the Superman head lifts, really no more than 10 seconds. Baby should have an opportunity to lift and relax. And let baby get reorganized and do a second lift and relax. Let baby get organized for a second, and now it's time to eat. So here, it's that same thing. We're putting a lot of gravity on the jaw. We're helping the baby engage all of these muscles that were folded in this direction, that need to be folded in this direction for a big mouth open so that the baby can latch on better. So we're gonna do one more quick exercise, and I'm gonna use an exam table because I'm at the office today. You can use a tummy time mat on the floor, but we really wanna have a firm surface. I wouldn't use a soft bed for this because we're looking for something that baby can really bear against. So little tiny babies who are just a few days old, when they go to do tummy time, they usually have their legs frogged up. So let's see if my monkey will hold. And that's okay. What I like about this is that when those legs are frogged up, the tush is kind of elevated, and that kind of helps relax some of those stomach muscles. So if the baby has a lot of down gas that needs to pass, this tummy down elevated tush position can be really helpful. And what I like to do is do a little wiggle on their hips. Just kind of grab that bottom and rock it, very small movement, and just rock that baby's bottom. And as this happens, we're moving the upper body, we're engaging the neck, because the baby doesn't want to shake back and forth. So the baby's going to do a small engagement of these neck muscles to stabilize himself. And that small engagement, that's the little tiny movement that the baby needs to have the muscles in front be a little more engaged. So for babies who are a little refluxy, a little colicky, a little gassy, this exercise is really for those babies. We are relaxing that tummy in that little frogged up position, getting a little bit of pressure on that tummy. We're shaking those hips just a little bit. You know, we're talking about a 1/4 inch movement. And then that head is just getting ever so slightly more stabilized, and those neck muscles are really developing here. And you know, again, 8 to 15 seconds. It doesn't have to be very long. But now, baby has kind of moved that GI around a little bit, and it's gonna do better feeding because some gas has passed, the stomach's a little more relaxed, and the baby's worked those neck and shoulder and low jaw muscles just a little bit to prepare for feeding. So this is definitely something that you should let your pediatrician know that you started doing exercises like this, if this is what you choose. Let your IBCLC or your other lactation support professional know what kind of exercises that you've been doing. And when you go to see your dentist or ENT, or maybe your pediatrician will be doing a tongue tie evaluation, let them know you've been doing these exercises, and so they can see what the baby's range of motion is. A lot of times, continuing these exercises after a frenotomy procedure can help continue that stretching and have better results, especially with keeping that wound site active during the healing process. So I hope this is really helpful. If you have questions, we would love to help answer them. Put them down in the comments below. And while these exercises might not be exactly what your baby needs, these exercises are a very low level of intervention. And when they're done safely and watching the baby's cues, there's no contraindication to just having your baby held on your lap in a tummy down position. And remember, babies need to be back to sleep. So hit subscribe, leave us a comment, let us know if we can help. I hope that your breastfeeding journey gets much easier, because if you're watching this video, you've probably had kind of a stressful time. We would love to give you any other resources. And if there are other videos that you'd like to see us make, please leave a comment. We'd be happy to do that as well. Have a great afternoon.